today is a great day here at KAG Umoja as we celebrate the launch of the Mental Health Intervention Guide as well as the Facilitator Guide here. And this is a great work that began in 2019 when at Compassion International Kenya, the health specialists began to see an increase in the burden of the mental health issues among program participants and also use of substance abuses that were being reported. The church took up the initiative and began to think about a church-led community health initiative where now they would want to come up with ways of dealing with the mental health issues that were coming up. And so based on that work that was done, we began to think of a way we can scale it up a bit more. And so in the year 2022, we had a CIV, that is a complementary intervention, that was done targeting 4 clusters, Kilifi, Siaya, Nakuru, and Kisumu cluster, in addition to Nairobi, where now we wanted to see the work of the church-led mental health conversations increase and continue to see the work of it. And so what happened is that the idea was to have the church lead the conversations, but also to include other stakeholders within their communities, because as we all know, mental health issues cannot be dealt with one entity alone, not as Compassion, not as a church alone, but multiple stakeholders. The main aim of that, the intervention, was to be able to come up with a guide that was driven from the ground up, a mental health intervention guide that would address some of the issues that were coming up. And so that work has happened, and therefore we have come today to see the fruition of the culmination of efforts of a lot of dialogues that have happened over a period of time. One of the key things that also came out is that we have a coined intervention, a contextualized intervention that we are referring to as PESAS. PESAS refers to, in full, P stands for prevention of mental health issues, and then E stands for early intervention. When issues are identified, then they are intervened at an early stage before they escalate. And then we have S, that stands for self-awareness, where each person, the youth participants, the children, should be able to be aware of their mental health state, and therefore you can be able to take action once one is aware of their mental health status. And then the aspect of advocacy, we began to see issues of youth champions, youth ambassadors being reached to, so that they're able to be champions of change on mental health issues within their context. And then we have the issues of social action. That is, it goes beyond the church, it goes beyond the youth, but it also goes beyond to the community as well, the issues of social action.
Going forward, let us be aware of these symptoms that you'll see and say, this is just a normal thing. Things like lack of appetite. Some will lack sleep, some will have excessive sleep. Some other people will be tired every time. Some other people will feel that they have lost hope. Some others will also feel that you're not worthy. Whatever you're doing, the person you are not worthy to be that person you are. And when you get such symptoms, kindly, 1 or 2 of them visit your nearest facility. And let us also note, today as you're seated here, 4 Kenyans die daily out of suicide. Suicide that has been brought about by depression and anxiety.
And many of us, we normally suffer stresses, but we do not even know. Sisi hatujui, mazingira tumelelewa, hatujui kama your mental health is your right. It's important. We do not even understand. Tunafikirianga tu kwenda kucheza futa, volleyball, kukimbia, kwenda beach kuswim. We are not thinking of our mental stability. And that is why kuna watu ambao wako very bright, watu ambao wako talented, wataenda west kwa sababu ya kitu tu moja, mental stability.
So as a youth advocate, I believe we must create spaces where we can speak openly without fear of judgment. We must teach our peers that asking for help is not a sign of weakness, it's a sign of courage. We must raise awareness that depression is not laziness, anxiety, overreacting, and therapy is not shameful.
but I'll just be interested on capturing the key chapters. And I'll start with the background of this book. And we are saying that this guide is intended to provide an overview of key concepts, as well as offer some very practical tools for responding to mental health and substance abuse in our community. And we want to do it from a professional perspective. We don't just want to stand here and call ourselves counselors who are not equipped. The other chapter is talking about churches leading in the context of mental health and drug abuse. The other chapter, chapter 3, that talks about community and church role. The other chapter, I think this should be chapter 4, talks about trauma healing. The other chapter talks about ethical practices for community care. The other chapter that is of key importance to me is chapter 5, or rather it should be chapter 6 here, that talks about influence of social media on mental health and substance abuse. Now, the very final chapter I want to talk about is our key chapter that gives us the intervention. This whole journey was to end with an intervention. What do we do? Now, Harrison, you have told us our role as a community. You have told us about social media. You've told us about trauma healing. What do we do? Because we have cases of young people in our FCPs who are struggling. We have cases of young people even in our churches and our families. What do we do?
Let us work hard and be positive. Dealing with the people positively. In whichever situation, be positive. There is something good you can take from that person. Let's handle people with a lot of positiveness in our minds, in Jesus' name. Let us love people the way they are.
This intervention and this model of approach will be integrated in the programming for the churches that have gone through this, but also it's going to be scaled in many other counties across the country, because this is a pioneer work within Compassion Kenya, and we believe also within Compassion International. It is some pioneer work in terms of mental health awareness among the young people.
The book, vile nimeiona tu at a glance, is going to do a lot of work in our midst, and it is going to make the work easy. The work that we have been hiring other people to do, now we'll be able to do it by ourselves. So that is a milestone that we have seen, and I know that God is going to help us as we continue.